The content of this podcast has not been evaluated by Health Canada or the FDA. It is educational in nature and should not be taken as medical advice. Always consult a qualified medical professional to see if a diet, lifestyle change, or supplement is right for you. Any supplements mentioned are not intended to diagnose, treat, cure, or prevent any disease. Please note that the opinions of the guest or host are their own and may not reflect those of Advanced Orthomolecular Research Incorporated. Hello and welcome to Supplementing Health, a podcast presented by Advanced Orthomolecular Research. I'm your host, Dr. Paul Herkel. This show is all about applying evidence-based and effective dietary, lifestyle, and natural health product strategies for your optimal health. We are going to feature some very engaging clinicians and experts from the world of functional and naturopathic medicine to help achieve our mission to empower people to lead their best lives naturally. This episode of Supplementing Health is brought to you by AOR's OrthoAdapt. This comprehensive formula features adaptogenic herbs, vitamins, and an adrenal extract that mobilize internal energy stores, reduce the impact of stressful conditions, and activate whole body defenses. OrthoAdapt is AOR's premium anti-stress formula, and it is also available in a vegan formula without the glandular extract. Look for it today at your local retailer or at aor.ca or aor.us. Hello, everybody. My name is Dr. Paul Herkel, and welcome back to Supplementing Health. We have a great show in store for you today. We're going to talk all about antivirals. We're going to talk about acute, but we'll also talk about chronic viruses. And I'm here joined by Dr. Courtney Ranieri. I've worked with Dr. Courtney in the capacity that she actually works in the field of naturopathic medicine. She is a naturopathic doctor, and she really has this unique practice where she also has experience with antiviral therapies in kind of from a testing perspective, as she works as a consultant for the lab industry. And she has a practice that's focused on female health, hormonal health, pelvic health. She's also a pelvic floor therapist, which is a pretty cool combo. I'd like to welcome Dr. Courtney. Thanks for joining me today.
Thanks for having me, Paul. I'm excited.
Yeah, it's we work together in the context of testing, and one of the things that we have seen through talking to experts throughout the world on tackling infections and primarily chronic infections, one of the things that really came out to us was chronic viral infections are one of the big issues. A lot of people are focused on Lyme and these intercellular bacteria, but viruses are kind of like the classic intracellular, meaning inside of our cells, microorganisms. So how did you kind of get introduced to the antiviral and viral testing worlds?
Good question. Well, I mean, really interesting because we do know that it does affect so many people. So when you start to dig into why your patients are feeling the way they feel, you kind of, sometimes it comes back to chronic infections, viral infections, like you said, bacterial infections. But the more research we do on this topic, the more we know that there is a connection to these kind of infections and a lot of symptoms that we experience, autoimmune kind of conditions. There's more research on MS and Parkinson's and even Alzheimer's. So there's a lot of interesting research coming out, and that kind of sparked my interest in this topic. Just trying to get to the root, like as a naturopath, we try to look for the root cause of patient symptoms. And, a lot of the times it can come back to these infections.
Yeah, infections are something that are now being really appreciated as one of the key underlying triggers for chronic diseases. So before we get into that, because I find that really fascinating, I want to pick your brain on that. Just give me an overview. Let's just chat for, especially the benefit of our listeners, what are viruses and what makes them kind of unique in terms of hijacking our body's own cells to work against it?
Yeah, totally. Viruses are really, really interesting because they actually use your own body's, your own cell's machinery to help them, replicate. So they use your, like I said, machinery to help them replicate. The viruses, attach onto cells. They insert their DNA, and then they use your cells' machinery to replicate, make more of themselves, which then go on to infect other cells. And that's that's how you can see that it can, very easily multiply in the body. Viruses are sometimes kind of hard to slow down because of this quick replication they have, and the efficiency of doing so as well.
Yeah, and so they use these various receptors to bind onto in our cells, and then they incorporate their own DNA into each one of our cells that they infect, and then they use the cellular machinery to actually replicate themselves. So as you said, it's kind of a really sneaky way of basically creating an infection in a host. And ultimately, it's tougher for the immune system to sometimes see these viruses because they are inside of our cells. And so that's always been a challenge with any of these kind of more intracellular or inside of our cell organisms. And so there's a difference between acute infection. So obviously things like influenza, obviously everyone's dealing with the current situation. But you have had kind of like a special interest in dealing with a little bit more chronic infections. And you mentioned a couple diseases that a lot of people have never associated with viral infections. So can we speak to just viral infections and their prevalence, and not just, I'm sick with a viral infection, but also as kind of the initiating factors in a lot of the conditions that people would never associate with a viral condition?
Yeah, really interesting. And like I said, a lot of good research coming out on this topic now. And what we know is people actually have been infected by a lot more viruses than we have ever known. For example, Epstein-Barr virus, also known as mono, we associate that with like the kissing disease. People who are, teens and 20s kind of get it. But what we now know is that if you look at all of the adult population, about 80% of people have antibodies to this Epstein-Barr virus, meaning that they have been infected in the past with it. And that specific virus, we are now finding out can lay latent in the body. So that term kind of just means like the virus is sleeping. It's not really active at that time. And what can happen, what we think can happen, is it can become reactivated as well later down the road.
And what are some of the things that reactivate it? Because if you say most of us have these viruses, and I've seen the research too, so we're all walking around Epstein-Barr, why do we not all have mono, where some people have a very kind of strong infection and then they're out of it for a couple months?
Totally. And that comes, back down to the immune system. So some people's immune systems do a really good job at keeping it latent, sleeping. It stays dormant for forever, for their whole lifetime. For other people, there may be some things that happen during their lifetime that can trigger the reactivation. Things like, another infection. Some, with Lyme, we see a lot of co-infections with it. Even the herpes virus, that can reactivate EBV. Also chronic stress. We know that stress dampens the immune response, decreases our ability to get rid of infections. That can cause a reactivation. Anything else that can suppress the immune system. So poor nutrition, lack of sleep. A lot of patients who experience this have told me, like, I had a really stressful year. I wasn't sleeping, I wasn't eating very well, and then they started feeling the after effects of the reactivation. So basically anything that can decrease the immune system in some people may trigger this reactivation response.
Yeah, so fascinating. And so I guess from what you're saying is that viruses are inside of our bodies all the time. And so, anybody that has heard of, herpes virus, right? So it's hanging out in one of the facial nerves. And then when you get stressed, you get an outbreak.
Exactly.
And so it's almost like the immune system, and this is an important takeaway point, is that the immune system is constantly keeping these viruses in check. And then when a stressor, it could be, a breakup, it could be a move, it could be anything really. It can be, something as simple as another infection, or, whether it's psychological, physical, mental, emotional, and that brings out this infection. So one of the things that that you mentioned is the Epstein-Barr virus and mono. Just since we're on the topic, what would be the thing that a person that contracts Epstein-Barr virus and mono, what's the first things they should be thinking about in terms of getting themselves on the road to recovery?
Yeah. Well, again, like you said, it comes down to the immune system here. So with Epstein-Barr virus, with mono, it affects T cells. So we need to make sure that we are giving the immune system what it needs to help to put out all of these immune cells and all of these immune proteins to help kind of kill off this virus, or keep it at a level that's not causing an infection anymore. Lots of great antiviral herbs and some nutrients that are really important. My favorite one, or the most, people know the most, I would say actually two: vitamin C and zinc in particular. Those are really important nutrients for the immune system. We know that zinc, for example, helps to reduce the incidence of, some cold and flu symptoms, and it can help with some incidence and how often people are getting it. It helps, the zinc in particular helps the immune system differentiate its cells and produce more cells, which is really, really important during that acute immune response.
Yeah, for sure. I always tell my patients that when you're sick with any sort of infection, your demand and need for vitamin C goes up exponentially.
Yeah.
And that is one key, I would say, factor that has been overlooked by both the research world as well as people recommending vitamin C, because the body has a much higher need. So they need to take much higher amounts, and they can handle much higher amounts. So you can go to bowel tolerance, you can get up into, and that bowel tolerance actually change because your body can absorb a lot more of it. And I've heard of zinc, as being one of the most important factors, not just for healing of tissues and differentiation, but also in terms of actually being able to, the virus getting into our cells and infecting them and then replicating. So zinc is adequate zinc levels are really important. Can you, like, one of the most common questions that people ask me as patients is like, oh yeah, you know what, I eat a lot of vitamin C rich foods. Can you get enough of both vitamin C and zinc through your diet, or do you need a supplement?
I think it really depends, but I prefer to supplement with it, so I know exactly, how much patients are getting. It's very hard to determine how much vitamin C or zinc you're getting from foods. And, it's obviously we want to promote foods that are high in those two nutrients, but at the same time, I think there is a need for supplementation. I mean, everybody's different, of course, but I think it's really important to supplement with those two because it is quite a little bit difficult to get enough. And like you were saying, at the levels we would want to see it at through food and nutrition. Definitely it helps to include those foods, but sometimes we need a little extra outsider help.
I would even take it one step further, and there isn't great sources of zinc in our diet. I mean, obviously in the textbooks, the one that comes to mind is oysters. I'm like, people are not really eating oysters and shellfish as a good source of zinc. And so, you do get small amounts in trace amounts in animal products. And definitely if you are eating a poor diet, you're at increased risk for both deficiency in vitamin C, which is found in your colorful fruits and vegetables. Like, for example, one of my favorites is red pepper and other sweet peppers, that they're quite high in vitamin C. There's a number of fruits, oranges being one of them, not the highest, but one of them. And that's something that needs to be consistent, all the time. And when you're stressed, when you're sick, you're not eating as many of those healthy foods and those high vitamin C rich foods. But I do want to make the point of, over the years, there are periods of time where you don't eat as much, especially zinc, and your body levels generally start going down. And the amounts that are in our foods are generally not as high as we think that they are. So there's a definite need for what I consider kind of orthomolecular dosing, or like supraphysiological dosing. So what are some of the dosing strategies? Maybe not specifically, but in general, what kind of doses are you looking at when it comes to vitamin C or zinc?
Yeah, vitamin Yeah, vitamin C and zinc, like you said, when you are feeling sick or you have an infection, your need does go up. And some of the research on vitamin C and zinc has looked at, vitamin C in particular, oral doses, anywhere between 1,000 to 2,000, and we can go quite a bit higher than that.
Right.
And you know as well that lots of naturopathic doctors and other doctors are doing also vitamin C intravenously at much higher doses than this.
Mhm.
And you touched on a little point there where what's the difference? Why can we go so high in an intravenous dose versus a oral dose? And that comes down to bowel tolerance. So when we mean that, or when we say that, we mean, sometimes very high doses of vitamin C orally can cause looser stools or some kind of discomfort there. So orally, a lot of the research is on 1, 2, 3, 4,000 milligrams of that vitamin C, and zinc is usually around 30.
30 milligrams, yeah.
Yeah, yeah.
And in terms of just some practical things, zinc sometimes can make people a little bit nauseous, right?
Yes.
So can you speak to just some of the applications of zinc supplementally?
Yeah, well, usually with those kind of supplements, I always tell patients take it with meals, just to help with that nauseous side effect. Some people don't experience it at all. They can take it on an empty stomach. Some people are a little bit more sensitive to it. So just to be on the safe side, I always say, take that with meals.
Yeah, for sure.
Yeah.
Okay, so I mean, those are like two of the foundational things when it comes to any viral infection. So we were talking a little bit about Epstein-Barr virus. What are some other conditions other than mono, which a lot of people just have to kind of go through the process? For some people, they bounce back, within a month. There's definitely enlargement of certain organs, spleen, and so obviously that's why they avoid all contact sports. So you have to obviously listen to your doctor's advice on that, because that is definitely legitimate. But in my experience, applying some of the things you just talked about, it can be quite helpful, and even using those intravenous doses to really get high levels to support the body's ability to handle an increased viral load as the body's dealing with this kind of more exaggerated Epstein-Barr infection. But what are some other conditions that Epstein-Barr is involved with? Because it seems like this is a usual suspect on a number of cases, and I've seen this in a lot of different research now.
Yeah, so the biggest thing that we have associated Epstein-Barr virus with chronically is thyroid conditions. So specifically autoimmune thyroid conditions, that's your Hashimoto's and your Graves. And that's again, like how I kind of got really interested in this is I see a lot of women in my practice, and a lot of times they are presenting with that fatigue and the difficulty losing weight and, dry skin, loss of hair, and that we can sometimes pinpoint to the thyroid condition. And we want to treat that, but we want to also get to the root cause, and that's where the looking a little deeper and finding out if there's a viral infection associated with it comes into play. And what's interesting, why we think that EBV affects the thyroid is something called molecular mimicry. So basically what that means is the virus actually mimics the body's own proteins, which triggers an immune response that causes an autoimmune attack on those tissues. So for example, the EBV we think may be mimicking thyroid tissues, and that can trigger that autoimmune response that we associate with, again, Hashimoto's and Graves' disease, hypo and hyperthyroid conditions.
That's so fascinating, because this is definitely not something that's talked about from a mainstream endocrinology perspective. And as you mentioned, autoimmunity is a huge reason why people suffer from any sort of thyroid conditions. And often, in my experience, the autoimmune markers, first of all, are missed because they're not being tested. And then secondly, if they are being identified, definitely the potential of a viral trigger or a cause is not being considered. So kind of what you just said is really mind-blowing. And so if a person has a thyroid issue, how should they go about checking if this is an actual problem for them?
Well, you can, like you said, doing all the testing, checking the antibody levels. A goal with any autoimmune condition is to bring down those antibody levels to a point where the body's no longer attacking the thyroid, because with all those autoimmune conditions, the reason why we are having not optimal levels of thyroid hormone being produced is because of that attack on the tissues. So checking those autoimmune levels, we can actually, do an EBV panel where we can check for, a chronic infection. We can check to see if it has been reactivated. We can check to see if, it is positive right now. So there's a lot of interesting testing we can do to take a look at that. And I'm a big fan of testing in my practice, as I know you are as well, to kind of, they use the term like test, don't guess. And I really truly believe in that, because when we kind of know exactly what's going on, we can put together a bit more specific treatment for patients that, will ideally help them better.
Of course, yeah, and especially in this case, because this is a potential cause that, first of all, a lot of listeners right now are probably have their mind blown that there could be a virus that could have caused their thyroid issue. So I think to summarize what you're saying is that, first of all, if there is a thyroid issue, that should be identified, properly tested with a full thyroid panel, as in TSH, free T3, free T4. And then the autoimmune markers you're talking about is the anti-TPO or anti-thyroid globulin antibodies. That's usually the most specific and sensitive one. There's also anti-TG, which is an anti-thyroid globulin. And so the anti-TPO is one that I usually start with. And if those are positive, well, now there's an autoimmune process going on. And as you said, that's where you can now look at some of the potential viral tests that are available. Is this the standard test that a person can just go to their lab with their family doctor, or are you talking about something a little bit more advanced?
So for acute cases of mono, a lot of the times they do something called a monospot test. So it's not that's a public health test. This is again, looking at the the immune response to that EBV. So it's an EBV panel. It's not the monospot testing.
Yeah, so this is over and above what's covered through public health, but it gives you a lot more information about, is this, and actually more accuracy if this is actually something that's affecting you, right?
Yeah, and it gives us a clearer idea. Again, it tells us, IgG, IgM levels, where IgG means chronic or, past infection, where IgM means active. It could be active new or active reactive. And that's how we get a little bit more information from this. So it's like peeling back the layers. This is like the next layer of the testing. Okay,
so perfect segue. So a person finally gets to the point that they have positive TPO or positive thyroid antibodies. They have the diagnosis of Graves or Hashimoto's, which are autoimmune conditions. Can something be done about it? What are their options? Because at this point, a lot of time people are like, well, you know what? From conventional perspective is, well, we can't really do much for you. What do you think?
Yeah, and I think there's like a stepwise process to this. So, I kind of take a 5-step approach to treating these kind of conditions. And the first one being figure out what's going on. So like you said, that's the testing. That's the first thing we do. Then we try to kind of, help with the infection. So like we talked about, doing some things to help the patient, get through the symptomology of it. And then the next couple of things we do is optimize the gut health. The gut we know is so important for our immune response. 70% of our immune cells are actually around our gut. So we work on gut health, we work on nutrition. And actually the last step I do usually is modulate the immune system. That's the last step, and I think that's really important in this process to kind of go through these steps sequentially to make sure that we are helping the patient heal and not kind of trying to jump to the next step too quickly.
Yeah, just for the sake of our listeners, what's modulate mean for everyone that's listening?
So modulate means essentially modify the immune response. So for example, with the immune response, we don't always want it so ramped up, because that is the issue with autoimmune conditions. It's too ramped up against certain tissues. On the same side, we do want it working against viruses and bacteria. So modulating means, ramping it up where it needs to be, but kind of keeping it under control where it needs to be as well. And that's why I like the word modulate more than, ramp up or increase or boost. Exactly.
Yeah, that's such a great point, Courtney, because we think of a micro, we need to kill it. And in the case of viruses, there really is no such thing as killing a virus. It's the body has to live with it. And I've been talking in recent days about immune resistance and then immune tolerance, and kind of this teeter-totter between the two. And autoimmunity, especially now that you just pointed out quite incredibly that there could be a viral infection that could be triggering this. You want to fight the viral infection and allow the immune system to control it, but at the same time, you don't want an over response of your own immune system against self tissue, which is what the definition of autoimmunity is. So there's this balance between resistance and tolerance, and I think that's what you're referring to when it comes to modulation, right? Is that you're not trying to be overstimulating, but at the same time, you want to stimulate enough to create a response against the virus in a proper way.
Exactly. And it's like getting the body back to doing what it naturally should be doing, right? So getting it to, again, work really hard to kill off these viruses, but not kill off its own tissues or, start affecting its own tissue. So just getting your body back to where it should be.
Yeah, for sure. Okay, so I think we did a really good job of kind of outlining what's happening on the autoimmune viral connection. And I think just for anybody that's listening, anytime that there is an autoimmune process, you should be looking at with your naturopathic doctor or your functional medicine practitioner, your medical doctor, about an underlying infection of some sort. There's a lot of research showing that autoimmune conditions, one of the triggers is some sort of latent or chronic infection. And so for us now, Dr. Court, let's switch to some of the favorite things that you like to do to, as you said, modulate the immune system. What are some of the things that you find as go-tos in your practice, especially when you're dealing with kind of both acute and chronic viral infections?
Yeah, absolutely. So again, we kind of want to, approach this at a lot of different angles here. So we want to help the gut. We want to help the immune system. We want to help the stress response. So I personally like to use, a couple different things. It's not just one kind of thing that I use with everybody. And again, like as all naturopaths, we individualize our treatments. Everybody's treated differently depending on what's going on. One product that I really like because I think it hits it from a lot of different angles is the AOR, the OrthoAdapt. That one specifically because there is, a couple things in it that I like. There's the vitamin C, which we just talked about the importance of that in any kind of viral response with modulating the immune system. There's also licorice and ginseng, which we know are great antiviral agents. Very good research on that. And the last two things in it are two adaptogens. And if you're not sure what the term adaptogen means, it's a favorite of naturopaths. It's a herb or a product that helps to modulate or the body adapt to the stress response. So when we are stressed, that we release a lot of these stress hormones. What do those stress hormones do? Cortisol, those types of things. They actually shut down a lot of the immune response. So if we can, fight this from a lot of different angles, we can stop the body from, again, shutting down its own immune response by including some of these adaptogens. I really like that idea. I think it's so synergistic and so important to kind of work with it because like we kind of touched on at the beginning of this podcast, what are some of the reasons that people may not be recovering as well. And part of that is the stress response. So,
yeah, huge.
It's not just giving people antiviral agents and immune modulating agents. It's again, working on all aspects of health there. And I think that's a really biggie. And sometimes we overlook that as well.
I mean, I really love that you led with that as one of your favorites because you're right. It's not only addressing what's actually happening at the cellular level. You mentioned a number of those herbs help support immune function. Specifically licorice, and the active component is called glycerin, which helps reduce the ability for viruses to hijack the cells. So it can be very, very helpful. And in this particular product has very high doses of licorice. So that also has the ability to kind of like help the function of cortisol, extend its function. So people that are very fatigued, very tired, it definitely is one that, comes to the top of the list when it comes to conditions that, especially viral conditions that have fatigue as a big issue, which Epstein-Barr is known for very classically. But you mentioned, stress is massive as one of the underlying issues. So why not give an intervention that also helps a person adapt and deal with that stress, as opposed to the typical antivirals are kind of like, they're called viral statics, right? These acyclovir, valciclovir, this class of medications, they basically just like stop the replication of viruses, but they don't really help the body's resistance. So that's a really,
Right.
that really is truly immune resilience, what you're talking about, right?
Yeah, absolutely.
So let's talk a little bit about a couple other things that I know that you use in your practice, and I know a lot of other people have heard about. So when it comes to antivirals, what about echinacea? Like, echinacea gets sometimes all the spotlight because it's the most popular, well-known kind of immune supportive herb, and it sometimes gets the most negative press because there's some researchers finding that it's not helpful. And what's your take on echinacea?
Yeah, so what's interesting about echinacea, it's probably one of the, I would say, most well-researched herbs that we have out there. A lot of interesting research on it. Really a lot of research on acute infections, so things like colds and flus. And what we have found through this research is it does decrease the number of amount of time usually with these colds and flus. That's one of the benefits of it, and can reduce the number of total incidences that we see as well. Specifically with, again, colds, flus, upper respiratory tract infections. And one of the reasons why I like it in particular is it's pretty safe actually for use.
Yeah, so you're saying that there is good research supporting its benefit, and the negative press that sometimes it gets is not warranted.
I like it because I think it's a safe herb. I think that it's, I've found it to be effective in my patients. We know that it does have an effect on the immune system. It does stimulate, T cells and things like that. So I think that it can be very helpful.
Yeah, great. Well, that's good to hear because I know a lot of people go to that, and I think I've used it in my practice as well. And practically, I probably lean more towards like like a tincture, which is an extract of a herb that is in liquid, so kind of an alcohol base. And when you taste a really good quality echinacea extract, it's like your tongue tingles. Those are like the alkaloids, which is like one of the medicinal classes of compounds that echinacea contains. And so you can really tell if you have a good quality herb with that kind of like tingling in your mouth. So I'm sure you've experienced that before.
Yeah, I think it actually tastes not that bad. I kind of like it.
Yeah, I mean, I think it's sometimes biased hearing it from naturopathic doctors because, my
True.
kids will take anything. I was just telling my wife yesterday, I'm just so impressed that like my kids are like, whatever I give them, they're good. And I think I've trained them that way. But I know a lot of people out there are just like, oh, I don't want to take something, or my kid won't take it because it's, it doesn't taste great. And there are ways of making things taste better. I mean, for example, you can mix in a little bit of elderberry syrup, which has some of its own antiviral properties, and elderberry syrup tastes very pleasant and very sweet. You can mix a little bit of echinacea in that. There's a lot of combination products that might combine the two. So don't give up just because somebody you don't feel like taking it because it's not the most tasty thing. And echinacea is not bad.
And you can get it in capsulated forms as well. There are some good brands. There are some brands that do have very good quality and high enough dosing in capsules or tablets. So that is a possibility too if somebody does not want to do it in a liquid form as well. Yeah.
For sure. Okay. Any other things that you think about with your patient when it comes to your antiviral approach? You mentioned we covered a lot of different core things like vitamin C, zinc, which I think both of us agree that are foundational. A good adaptogenic formulation, especially one that has licorice in it, I think is a great place to start. If a person really is under the weather and sick, then using intravenous therapy of getting vitamin C and zinc. You can't do every herb, but you can actually you can do safely vitamin C and zinc. Anything else that you think our listeners should know in terms of having in their kind of like antiviral repertoire and medicine cabinet?
One thing you may not think of as an antiviral or like a cold and flu kind of supplement is actually probiotics. And that's a really interesting one. I mean, most people have heard of probiotics, and what probiotics are essentially are, capsulated bacteria that we can ingest that we hope will help to kind of flourish and live in our gut microbiome. And I just did a presentation on this recently, so I have all these stats on the microbiome, but what we believe is there's about 3 to 4 pounds of bacteria in the gut alone.
Wow. And
it's really important that we kind of make sure that we have the right kind of types and of bacteria in there. There's very good bacteria in our gut that help us to activate enzymes and, hormones as well. And there's other bacteria that is pathogenic. So probiotics help to kind of increase the amounts of that good bacteria that we want in that gut. And some research, a 2015 review showed us that probiotics were better than placebo for decreasing episodes of upper respiratory tract infections and decrease the time that people had these upper respiratory tract infections as well, which is interesting. Again, something we don't think about as an antiviral. And to even segue that over a little bit back to EBV, there has been some consideration and studies into looking at the effect that the gut has on thyroid conditions and mono, and particularly one pathogenic bacteria, blastocystitis. There is a connection between that, EBV, and thyroid. And again, it comes down to making sure the gut has good bacteria in it. We're modulating it. And trying to decrease the amount of the bad bacteria in there.
Yeah, I'm really glad you brought that up. Thank you. That's such I think a powerful point, that especially as a takeaway point of understanding that your gut, and as you mentioned, 70-80% of our immune system is in and around our digestive tract, and that's just the immune tissue, like your lymph tissue, where your immune cells mature. And so I think it's, this is definitely something that we could do a whole episode on, and just diving into how the immune system is exposed to all the different foods and proteins and chemicals that you ingest. And then that's how they learn what is normal, what is our own tissue, and what is actually a bacteria or pathogen. And so that's the first place that usually you get exposed to, is in your gut. And so that's why there's so much immune tissue around there. And if you are eating foods that are really high in sugar and refined chemicals and fats, and really in pro-inflammatory molecules, you're basically priming your immune cells to have a poor response. And that includes to fight off viral infections. And probiotics, as you mentioned, help support the body's own bacteria, which are key in regulating that kind of maturation process of our immune cells. So I'm really glad you brought that up, because I can't emphasize that fact as much. And it's so great to see that there's research being done on this. And mechanistically, it makes a lot of sense. And I think definitely naturopathically, traditionally, we've known that this is one of the key things to chronic infections. So definitely, as you mentioned, with autoimmune conditions, you've heard it probably, listening to podcasts, other podcasts, and reading blogs online, or maybe even from your own naturopathic doctor. Well, if you have an autoimmune condition, you have to treat the gut. Well, this is why you have to do that. And so do you have a particular strain of probiotics or anything that you practically recommend, Dr. Courtney?
I'm like picky about my probiotics in the sense that I usually change it up depending on the patient. So like, as you know, there's specific strains that have been studied to help with specific things. So, if the patient is experiencing, or, for example, traveler's diarrhea, you want to prevent that. There's specific strains we want to be taking for that, or autoimmune conditions, specific strains we want to use for that. With any probiotic, you want to make sure that the amount of bacteria inside each capsule is good, and that's usually shown on the label as a CFU, which means colony forming unit. That's how we kind of tell how much bacteria is actually in the capsules. You want to make sure there's enough in there. I'm also particular about the way that it is encapsulated, because what we want to do is make sure that bacteria is actually getting to where it should, which is in the large intestine mainly. there shouldn't be that much bacteria in the small intestine, or else that leads to a whole other issue, SIBO, or in the stomach as well. So we want to make sure that bacteria is actually going to resist that stomach acid, resist all those digestive enzymes, and can make it to, like I said, the large part of the intestine there, and the colon.
Yeah, and there's hundreds of different strains. So,
Yeah.
I mean, I think that's a hard question to answer. Like, what strain would you use? There are, lactobacillus, there's bifidobacter, and then there's other ones that from the Clostridium family that do other things. So, I mean, I think we'll save that for a whole nother show, because, to do justice to that question, really, you have to kind of break down all the different strains. But as you mentioned, those are some good points, looking for a good amount of probiotics. Like 20 billion is something kind of a benchmark that I use per capsule. It's a pretty good dose, or as a total dose. And then definitely the quality matters, in my opinion. So usually you definitely get what you pay for when it comes to probiotics. Keeping them in the fridge, and if it's an added bonus, some strains, like there's one bifidobacter, BB536, I'm thinking of specifically, that has research in influenza, and it is shelf stable, and that is an added benefit where you are going to get it into the tissues, into the gut, and past the stomach acid, past the small intestine, where it can actually inactivate the probiotic and kill it. So there definitely is some specifics, and I would say talking to your naturopathic doctor could really help you identify those specific strains.
Yeah, and I agree with you there. The one supplement I don't think you should cheap out on is a probiotic, a good probiotic. You want to make sure you're getting, some good stuff out of it, and to do so, I think you need to spend a little bit of money on a good quality product there.
For sure. Dr. Courtney, thank you so much for joining us. This was intriguing. I'm really glad you shed some light on this connection between viral infections and autoimmunity. This is something that we haven't talked about yet on the show, but we'll have to explore it even more. A lot of people are suffering from not just viral infections, but a lot more even from autoimmunity and thyroid issues. So this is something that is a message that everyone needs to hear. If people want to get to know you a little bit better and reach out to you and connect with you, what's the best way to do that?
Yeah, so like you said, I'm a naturopathic doctor in the GTA area. I have practices in Toronto, Mississauga, and in Woodbridge as well. My website is Dr. Courtney Ranieri ND.com. I'm also on Instagram at Dr. Courtney Ranieri, and feel free to reach out or say hi any of those ways.
Awesome. Thank you so much for sharing your insight. It was an absolute pleasure to have you on. And I'm sure we'll have to have you back on a future show to discuss some of the other things that you're seeing in your patients.
Awesome. Thanks for having me, Paul.
You're very welcome. Thanks to everybody for listening to this episode of Supplementing Health. Be sure to tune in next week as we chat with another expert about all the things that you need to know about getting the most out of your supplements and natural health. Till then, see ya. Thank you for listening today. For more information about our guests, past shows, and future topics, please visit aor.ca/podcasts. Do you have a topic that you want us to cover? We invite you to engage with us on social media to request a future topic, or email us at marketing@aor.ca. We hope you tune in again next week to learn more about supplementing your health.